Hello ladies and gentlemen, welcome back to another Workout Wednesday. Today we're following up with our series that we started on stress and migraine headaches, and it's specifically related to the posture, right? Suboccipital headaches. So what we're going to do is go through a few a movement progression that will help you alleviate your stress headaches, but most importantly, what I want to keep in mind is that this isn't a complicated progression. This is a very basic, simple progression that has very low risk, right? So it's safe for everybody to perform, and I hope you guys enjoy. Here we have Carrie performing cervical retractions into extension. She's using a foam roller as a bolster to support the cervical spine, and as she moves into retraction into a chin tuck, she's pushing the crown of her head upward into the pressure of my hand, which elongates the spine. Now all she's doing is she's got her arms into what we call a 90-90 position, which helps open up the chest and stretch out the chest muscles. And then she's working rotation, which she's basically trying to look at her armpit is the easiest way to think about it, which is helping to stretch the neck musculature. Now this is a setup for performing some rotations on a float or basically a ball. And this is to provide recruit additional stabilizer muscles in the neck, and this bolster is helping to hinge her thoracic spine into extension. If you notice, she's keeping her chin tuck and she's exhaling through the turn, which it makes it more effective. Inhaling back to center, and now she is performing side-lying extension and rotation activities here. She's using the top hand as a pivot point, and you'll notice that her left hand is a pivot point, her right hand is rotating over here, extending, and then she is working forward and now she switched positions. She's working extension, and then she's rotating forward into more of a rotation and flexion. And this is a great stretch for the upper trunk. Now, after you've done these mobility activities, it's important that you start to stabilize. And here she's doing slouch corrections, which is basically just a slouch position. And she's going to inhale and expand and pull the shoulder blades back and down. And then she's going to exhale forward and back into that slouch position, allowing the shoulder blades to move around her body freely. She's using the band here as a way to guide the motion and to provide a little bit of extra resistance for the mid-back. Well, there you have it, another successful Workout Wednesday. I hope these exercises and stretches give you guys a lot of value in terms of it's something simple you can do and you can perform on a daily basis, and it's not something that can put you at risk for further injury or for making this thing any worse, right? If you have any questions about these things, please contact a medical professional and get advice, because you don't want to be out in the woods trying to find your way back home whenever you have a map available to you. So I hope you guys enjoyed this video, and we will see you next week.